Pandemics by Colin Sinclair
Adam Schmidt.
Benedict Nursey.
and Isaac Pearson. What is a pandemic? According to Oxford Dictionary, a pandemic is a widespread occurrence of an infectious disease. Today in our presentation, the possible solutions to pandemics will be explored. But first, let's take a look at a brief history of 3 disastrous pandemics. According to Britannica, the Black Death killed over 200 million people around the world. This pandemic occurred from 1347 to 1351 and was spread through bacteria carried by rodents infested with fleas. This disease originated in China, however, reached Europe via general ships and other exports. The pandemic spread through Asia, Europe, and North Africa. According to Ruth Leinfeld, a medical director and epidemiologist in Minnesota, the Spanish flu caused over 50 million deaths in 1918 and 1919. Due to the pandemic breaking out right after World War I, when a significant amount of medical staff were stationed overseas, this led to hospitals being overwhelmed with patients and no staff to help. This deadly disease spread throughout all continents. Finally, a contemporary example of a pandemic, COVID-19. According to Adam D. Brown, an associate professor at the NYU Grossman School of Medicine, COVID-19 is originated in Wuhan, China in 2019. COVID-19 was able to cause the damage that it did due to its mutating properties. According to World Health, COVID-19 has claimed over 6.9 million lives. This disastrous pandemic has affected all continents. As we can see in this image, our school system learning was damaged by over 1.6 million children were displaced from schools. Environmentally speaking, the Earth's clean energy investment was reduced by over 30%. Along with this, over 250 million will be pushed to poverty as a result of the pandemic. The issue that has been recognized through these pandemics is a lack of readiness in the healthcare system because not enough treatment is available to patients and not enough personal protective equipment is available. Realizing such dilemmas in managing pandemics, how should global health systems be restructured to effectively create productive responses to emerging pandemic threats?
Our first solution to this issue is to put guidelines in place for forced isolation and quarantine. Travel restrictions have been shown to reduce the spread of infectious pathogens from a study done at the Zhangjiaotong University in China. Their study found that with travel restrictions, the number of infected individuals in 7 days will decrease by 91.14%. Quarantine, isolation, and border control have also been shown to lower infection rates. This has been shown through previous work done by the FDA, which found that these limit the spread from an infected host to a possible host, stopping the virus in its tracks. By making laws that would reduce the spread of a potential pandemic, this would put less pressure on our medical infrastructure and its healthcare workers, allowing them to more focus on treatments and cures instead of merely keeping people from dying. Because this solution would make laws forcing isolation and social distancing, there would be no human contact for the virus to spread. This strategy has been shown effective by the University of Sydney, which found that pandemics are best managed by self-isolation and social distancing. This solution would force people inside, leading to an increased opportunity for remote services such as Amazon or DoorDash, as people would be forced to order in more. However, a limitation of this solution is that the economy might slow because in-person businesses would struggle as there would be less circulation of money through our economy. Forcing people inside can worsen or even cause mental health issues and mental illness. This has been proven by Jacques Jean, who found that stress over the general population in Europe rose from a mere 8.1% pre-pandemic to an astounding 81.9% post-pandemic. The third limitation of this solution is that it could potentially disrupt the learning process and our education system, as it would force teachers to use less effective teaching options, such as Zoom or Google Classroom.
Next, solution 2 is investing in public funds to research and allocate supplies for future global outbreaks. According to Pranit Kumarjana, a virus researcher at the National Institute of Health, investing in advanced disease surveillance technologies can help identify and track emerging pathogens. Preemptively investing in solutions will bring about innovative measures of prevention and detection of certain pathogens. And a method that has been used to do this is genome sequencing, a method to which scientists are able to track the mutations of a possible virus. As seen in this quote from the CDC, genome sequencing is a process that determines the order or the sequence of nucleotides in a virus's genome. Along with this, providing ample amounts of personal protective equipment for medical workers, patients, and other citizens will be instrumental in limiting the spread of the virus. As for the implications of investing in solutions, a global safety net will be established, as countries with less supplies will be assisted, and such international collaboration will help facilitate the end of the pandemic. As governments and other bodies work together, solutions will become more pervasive. And finally, with more time of scientists spent in the field of pandemics, it is more likely that innovative treatments will come as a result. As we see in this image right here, when scientists took time to research the COVID-19 treatments, they found 4 oral and IV medications. However, some of the limitations of investing in solutions could be the fact that taxation will likely have to be raised on an international basis, which will have severe backlash. According to this image from the NIH, over $1 billion of government-funded money was allocated to researching pandemics from the years 2021 to 2022. Next, as we saw in the COVID-19 pandemic, the virus is able to mutate at a rate that is faster than trackable, and this could have discrepancies in research and possibly need more updating for research from scientists. And finally, without significant assistance, this solution simply isn't feasible due to the fact that it requires heavy public funding.
To summarize, the isolation solution diminishes the spread of the virus when followed by the public, which leads to less threats to occur. With the lower threats, it would lead to a healthcare system with less pressure on itself. But this solution may result in mental repercussions on the isolated individuals. As seen in a study by Jackie Zhang, who's a medical researcher who specializes in psychology, states that the anxiety of European countries has risen from 6.33% to 50.9%. On the other hand, solution 2, or investing in public funds, would allow access to supplies to be shared throughout countries, especially to the poor or less unfortunate countries which have been affected the most by COVID-19. With this, it would allow more research to be conducted and new possible innovations to be founded. But this solution would be costly and time-consuming. Which solution is better? Solution 1 is better as it's more feasible to mandate quarantines and higher taxations. It would require less funding from the government, and it's more successful as it effectively lessens the spread of the virus.
Thank you, Benedict. I'm going to ask you guys questions. I'm going to ask you first, Benedict. So, how did Isaac's research help your overall presentation?
Isaac's research helped our presentation as it gave a better background and understanding of what a pandemic is, and which allowed us to be able to build a better structure for our presentation. And
Okay.
with this,
Oh, do you want to say something?
and with this, we were able to build up our presentation to have a better understanding, to give better context for what a pandemic is.
Okay. Isaac, what is a way in which your team's resolution makes you think differently about the research that you do?
Well, after reading Adam and Colin's paper, I thought that isolation would be a great solution. However, like with the mental and the economic repercussions with it, I really changed mine with especially in solution 2, because the solution 2 extremely affected the economy poorly, because it costs a ton of money to do.
Okay. And Colin, reflecting on your colleagues' work, which one of their papers had the greatest impact on your understanding of the problem that your group identified?
I'd have to say Isaac's paper, as it like delved into the historical lens, and it really taught us what we did wrong in the past in previous pandemics, and so we can move forward to see what we need to do better for future pandemics.
Okay. And Adam, can you describe an argument from somebody's report that made you think differently about your team's conclusion?
So yeah, in Benedict's paper, he described the environmental lens, and I really didn't understand that, and the environmental impact of such pandemics had an instrumental effect on the economy, and Benedict really explained that in his paper. He's talking about how the global investment in clean energy was reduced as a result of the pandemics because we had to have more funding towards medical equipment and other things, etc. So I thought that was a really interesting perspective from Benedict.
Okay, great, thank you.